Go ahead.
Hooks are present in between the segments. In non-segmental, only start and end side hooks are present.
Yeah, distal hook as well as proximal hook. Okay, in the segmental you will see distal hook, proximal hook, and the middle hook also in the layman terms. Okay, so whenever you code arthrodesis, you need to use these instrumentation procedures separately. Okay, like bone graft, correct? So instrumentation also we need to code separately along with these things. Okay, so what is meant by vertebral segment? What is vertebral segment? Or what is the difference between vertebral segment and vertebral body?
A segment means L1, L2, L3, which called as segment.
Yeah.
Vertebral body means L1 to L3, L3 to L4.
No, this is wrong basically. So vertebral segment means combination of vertebral body plus intraarticular process like lamina, spinous process, transverse process. All those consist of vertebral segment. So basically, vertebral segment is a bony structure. Okay, we will see here. See, this is the bony part of the bone is like spine is vertebral segment. So this is complete vertebral segment. Okay, so this is the vertebral body. This is the transverse process. Okay, this is the spinous process. This is lamina. This is pedicule. All these combination of organs you call as vertebral segment. Okay, if the patient tells only vertebral body, only this area is vertebral body. Okay, so that is the difference between vertebral body and vertebral segment. Okay, next, what is vertebral interspace?
In between the vertebra.
Yeah, perfect. So basically, vertebral body or vertebral segment is the bony part of the vertebra. Okay, so interspace is the cushion-like material or cartilaginous material in between two vertebral bodies. So that is the difference between segment and interspace. So for example, if we have L1 to L3, how many vertebral bodies are vertebral segment and how many interspaces? L1 to L3, how many vertebral bodies, how many interspaces? Anyone?
Three vertebral bodies, two interspaces.
Perfect. Yeah. L1 to L2, one interspace. L2 to L3, another interspace. So total two interspaces. As vertebral segment means L1 one vertebral segment, L2 one vertebral segment, and L3 one vertebral segment. Okay. So like that you need to use these codes. Okay. So next, posterior non-segmental. So here patient will place uh, instrumentation on the back side of the spine. So posterior non-segmental instrumentation. So here your keywords are Harrington rod, pedicle fixation across one interspace, like that. If you see these keywords, sublaminar wiring, facet screw fixation, if you see in the operative report, you need to use 22840 and try to remember these all vertebral segment instrumentation codes are add-on codes. You can't use these codes along with arthrodesis. Okay. Mostly you will use these codes for arthrodesis. Okay. Next we have 22841. Internal spinal fixation by wiring of spinous process. Okay. If the patient tells sublaminar wiring, you will use this one 22840. Okay. If the patient tells only wiring, 22841. So just you need to remember these keywords. Harrington rod technique 22840. Pedicle fixation across one interspace 22840. Atlantoaxial transarticular screw fixation 22840. So these are the keywords for you. Okay. So next 22842. Here only wiring. Spinous process here. Okay. This is the spinous process wiring 22841. 22842 posterior segment instrumentation. Okay, 3 to 5 vertebral segment. As it is a add-on code, you need to use this code with your primary procedure, which is which procedure, guys? What is the primary procedure for this code?
Arthrodesis.
Yeah, perfect. Arthrodesis.
Laminectomy.
Yeah. Arthrodesis, you need to use these codes. Here also same keywords. Pedicle fixation, dual rods with multiple hooks and sublaminar wires. Okay. And 3 to 6 vertebral segments. 22842. So if you see this one, wiring at C1. So cervical vertebra, you can use 22840. Only for cervical vertebra. Okay. So you can use these codes other than cervical vertebra. Here why means code description does not have any spine nomenclature here. So we can use for other spines this one. 22842. Next 22843. So basically based on number of vertebral segment. 3 to 6, 22842. 22843. 7 to 12 vertebral segments. Okay. So tell me vertebral segment is a bony part of the vertebrae or cushion material of the vertebrae? Or non-bone part of the vertebrae? What is vertebral segment? Bony part or non-bony part? Anyone, guys?
Bony part.
Yeah, perfect. Bony part of the vertebrae is vertebral segment. Okay, so 7 to 12 vertebral segment, 22843. Okay, 13 or more vertebral segments, 22844. Just you need to count the number of vertebral segment. That's all. This is very easy. Okay, so what are the key things here you need to remember whenever you want to code posterior segmental instrumentation? You need to check patient's position, whether it is supine or prone, and you need to check where patient is performing the spinal location, whether it is thoracic, lumbar or sacrum. Okay, so like that. Next so far we have seen posterior segmentation. So here patient will be on prone position. Okay, next we have anterior instrumentation. Here also same 2 to 3 vertebral segments. Okay, here 4 to 7 vertebral segment, 22846. Next 22847, 8 to 8 or more vertebral segments. So you don't need to worry. Whenever you want to use these codes, add-on codes, you need to check these codes. It is very simple. You can use these add-on codes along with these primary codes only. Okay, you can't use these codes with other musculoskeletal system procedures or spinal procedures. Just you need to follow these like 1, 2, 3, 4, 5, 6, 7. 7 lines of codes. So along with these codes or primary procedures only, you can use these instrumentation codes. Okay. Next 22836. Anterior thoracic vertebral body tethering, including thoracoscopy when performed, up to 7 vertebral segment and 8 or more vertebral segments. Okay. So basically, here also patient wants to perform the correction of any deformity. Okay. So here patient will like insert the tethering device. Like a tethering device is like a wire. So he will place wire in the spine and he will correct the deformity. Okay. So if you observe this code, patient will perform this type of tethering for only thoracic vertebrae. Okay. Here also you need to code based on number of vertebral segment up to 7, 22836, 22837, 8 or more vertebral segments. Okay. Next 22838. Revision, replacement or removal of thoracic vertebral body tethering, including thoracoscopy when performed. So tell me, in 22838 thoracoscopy is mandatory or not? Anyone? Thoracoscopy mandatory or not? How do you identify? So here thoracoscopy is not mandatory. What is your keyword? When performed. So they are telling if the patient performs thoracoscopy, you can use. If patient does not perform thoracoscopy also, you can use this one. So basically wherever you see when performed, you need to understand this is not mandatory. Okay, so without thoracoscopy also you can use this one. Next 22848, pelvic fixation other than sacrum. So if the patient performs any type of pelvic fixation, anyway you will not encounter this code 22848. Okay, 22849, reinsertion of spinal fixation device. So if the patient removes the spinal fixation device and if he reinserts, you need to use 22849. Okay, so 228450, removal of posterior non-segmental instrumentation. Example, Harrington rod. So here these are. So if we see here Harrington rod, these are insertion, posterior non-segmental instrumentation, Harrington rod. Okay, so these are insertions basically. So if the patient removes those Harrington rods, you need to use this one 22850. Okay, so 22852, removal of posterior segmental instrumentation. So this is non-segmental, this is segmental. So whenever you want to code removal of instrumentation, what is the important keyword, guys? What is your important keywords?
Segmental or non?
Yeah, perfect.
Segmental or non-segmental?
Yeah, non-segmental. And also one more keyword.
Posterior.
Yeah, perfect. Yeah, posterior or anterior. Simple.
Removal.
Yeah.
Removal.
That also correct, no? Removal of anterior also patient will remove, correct?
Yes,
So you need to check anterior or posterior as well as segmental or non-segmental. Okay. And we have few more codes here. 22853. Insertion of interbody biomechanical devices with integral anti-instrumentation for device anchoring when performed to intervertebral disc space in conjunction with interbody arthrodesis, each interspace. So in the operative report 22853, you will see it as P case. Okay, you will see it as P case. This is one. Okay, so these are the P cages. Okay, so you need to code these P cages based on number of interspaces. For example, if the patient performs L1 to L3, insertion of P case, how do you code? 1 or 2 or 3? How do you code, guys? You need to code based on interspaces, correct? So L1 to L3, how many interspaces?
2 interspaces.
Means how many codes, how many times you will use 22853? 2 times, na? See here, each interspace.
2 times.
Each interspace means you can use multiple times this code, 22853. Okay? Only,
Yes.
so only one consideration is you need to use this code along with these primary codes. See here, report 22853 for each treated intervertebral disc space. So if the patient performs T1 to T4, how many codes you will use? T1 to T4. How many codes, guys? 22853, how many times? 4 times
3
or
times.
3 times?
3 times.
Yeah,
3
perfect.
times.
Yeah, 3 times. Why means our code description is having what do you call? Each interspace. So because of the reason you need to
there
use
is only 3 space.
3 space. So you need to remember peak case. Peak. So this one. In the operative report, if you see P case, you will use this one. 22853. So 22854. Okay. So here also patient will place the biomechanical device, but this is for vertebral carpectomy. So this is for arthrodesis. Okay. If the see here interbody arthrodesis. Okay. If the patient performs carpectomy along with arthrodesis, you need to use 22854. Okay. 22859. Insertion of intervertebral biomechanical device to intervertebral disc space or vertebral body defect without interbody arthrodesis. So if the documentation does not have any type of arthrodesis, that time you need to use 22859. Okay. Next we have these codes. So this is the P case. 853, 854, 859. Okay. So this is the, I told you correct, peak. Methyl methacrylate replacement. So this is the P case. Next, 22855. Removal of anti-instrumentation. So previously we have seen post-instrumentation, correct? So now this is for anti-instrumentation. Okay. So now finally, what are our keywords for instrumentation? What are our keywords, guys?
Segmental,
Anterior or
non-segmental.
posterior?
Yeah, perfect. Yeah, anterior and posterior. What is next one?
Segmental, non-segmental.
Yes. Next.
Then this
And
peak
how many
or
interfaces?
Yeah.
space. Then type of insertion. Removal.
Yeah. So here, whenever you want to code instrumentation, you need to check whether patient is performing arthrodesis or not. Okay. Next to spine location. Why means we have these codes based on cervical spine also, correct? First code is related to cervical spine. So you need to check the spine location. Okay. Next, how many interspaces? Next, you need to check whether it is anterior instrumentation or posterior instrumentation. Okay. Next, you need to check if the patient is performing any type of case, peak case. Okay. Next, you need to check whether patient is performing any arthrodesis along with carpectomy. Why means we have separate codes for intermechanical device insertion or peak cage insertion. One is only with arthrodesis. Another set of code is arthrodesis with carpectomy. Okay. So these are the keywords you need to remember while coding instrumentation, and most of the time you need to use these instrumentation codes along with arthrodesis procedures as well as graft procedures. Okay. So these are the important keywords you need to remember while coding these procedures. Okay. Next we have 22856 total disc arthroplasty. Anterior approach including discectomy with end plate preparation, single interspace, cervical, second level, cervical. Okay. What is arthroplasty, guys? What is arthroplasty?
Surgery in the joint.
That is correct. What is exact definition?
Fixation of joint.
Yeah. So basically arthroplasty means repair of the joint using pins or screws or bone graft, tendon graft or cartilage graft or fascia. Okay. So basically most of us think that arthroplasty means only replacement of the body part, where whenever physician wants to replace the body part, he may use bone. Okay. Pins or screws like tendon, ligament, cartilage, soft tissue. So everything comes under arthroplasty only. Just here they will repair based on the patient's requirement. Okay. So but in our CPT coding most of the time total disc arthroplasty means here patient will remove the disc and he will place the artificial disc. So it's simple. See, this is the artificial disc basically. See this one. See, artificial disc placement. So this is the damaged vertebra or interspace. So patient will remove this one and he will place this one. Okay. So that is the arthroplasty. For cervical single interspace 22856. For second level 22858. Okay. Next we have lumbar. Total disc arthroplasty, anterior approach, single interspace, lumbar 22857. Okay. Next we have second interspace, lumbar 22860. Okay. Revision including replacement of total disc arthroplasty, cervical. So here in 22861, patient will remove the previously placed disc in the cervical vertebrae and he will revise the vertebrae. For example, if the patient is having any type of pain due to screws, patient will remove that screws and he will insert again. For example, if the patient is having arthroplasty performed but that is damaged, patient will remove that arthroplasty device and he will place this one, replacement, new one. So that time also you can use 22861. Okay. So this is for cervical. If the patient performs same procedure on the lumbar area, 22862. Okay. For here, for additional interspace, you can use 0098T for additional interspace. In lumbar area, you can use this one, 0165T. So tell me in the documentation, if you see revision of L1 to L3, how do you code? L1 to L3 revision or replacement. First, what do you need to check?
How many interspaces?
Yeah, perfect. Then how many? L1 to L3.
2 interspaces.
Then how do you code?
22862 and 22864. Sorry, 22862 and 0165T.
Yeah, correct. For additional interspace, use category 3 code. So basically,
Yeah.
these are the temporary codes. Okay. So like that, you need to use 22862 and 0165T. If the patient performs true interspaces revision of arthroplasty. 22864. Removal of total disc arthroplasty, anterior approach, single interface cervical. This is for lumbar. So insertion, revision replacement and removal. Okay, simple. These are also based on type of spine, cervical or lumbar. Okay. Next 22867. Insertion of interlaminar interspinous process stabilization distraction device without fusion, including imaging guidance when performed with open decompression lumbar, single level, second level. Okay. Usually you will see it as Coflex device. So this is the interlaminar device. See, the Coflex device can be used to treat LSS and is a single piece titanium implant that is stable, strong, flexible enough to give strength. So this is the Coflex device. Okay. So patient will use these Coflex devices in the spinous process. Okay, not in the disc here. Here is the spinous process. In between spinous process, patient will use this Coflex device. So that time will use 22867. Single level 22867. 22868 second level. Okay. So we don't have insertion interline interspinal distraction without open decompression or fusion. So what is this one? With decompression. With open decompression. This one. Okay. So this is without decompression, without fusion. 22869.